So please don't hesitate to go ahead and do that. And we just want to welcome you to the webinar with Adrianne Cordero. And a little bit about me. I am Darlene with SeniorLivingGuide.com. I work on the website side for the most part. I also host our podcast, SeniorLivingGuide.com podcast. And I just want to mention Adrianne just did a podcast for us, and it is available on Spotify, Google Podcasts, or really anywhere that you would listen to a podcast. And it is also available on our website, SeniorLivingGuide.com. And there is a link for podcasts, and you can click on that where all our podcasts are housed, and hers is actually the last one. And so you can definitely check that out if you like this. It's more geared towards seniors and caregivers. So we're going to get a little flip side on the podcast itself, but it took off like a banshee once it posted onto all of the different places where it can be listened to. So it's done really well. And a little bit more about me and what SeniorLivingGuide.com does, as well as we do have our national reach websites that does provide seniors and caregivers with ways to connect with communities, including independent, active, assisted, skilled, memory care, and even home care services directly to find what would best suit you. We also have print publications in Florida, North Carolina, South Carolina, and Virginia. And then we also have a hospital directory in multiple markets. You can click on our website as well and see that under industry professionals where those are located. So that's a little bit about SeniorLivingGuide.com, and we just keep growing in the opportunities that we provide our clients. Each and every month, it seems, we've just kind of gone a little bit bonkers. So that's a little bit about us, and I'm going to introduce Adrianne, and she can kind of tell you about herself. I'm going to let her take off of that.
Awesome. Can you hear me okay?
Yes.
Okay, just making sure. But yes, I'm Adrianne Cordero. I am one of the care managers with Sierra Health and Rehab and Rockledge Health and Rehab, which is owned by Millennial Healthcare. I've been in skilled nursing, for over 10 years. I absolutely love it. I kind of joke around and always say that, healthcare raised me. Like, I was raised by a single mom, and she's an occupational therapist. So she would bring me to the skilled nursing centers and the ALS that she was, practicing her therapy on. And I would just get to know and fall in love with some of the seniors that she was treating. And so I kind of knew that in some realm, I really was going to go into healthcare. I just didn't know in what form. So again, I'm just very grateful to be able to help the seniors in any way, shape, or form. But definitely one of my first loves. And the fact that I'm still going strong in it and still loving it really and truly means the world to me. So since I've been throughout this realm, obviously years before COVID, that's why I'm here, is just to kind of give you guys a little bit of a synopsis on the new normal. There's a lot of changes, and I think there's a little bit of fear, not only in the patients themselves, but also in staff, or in just healthcare in general. Like, this is kind of unveiling just on the rehab side, because I know it's changed for all realms of healthcare. Really, COVID has affected everyone. But this, again, is just to kind of go forth and pull the curtain back a little bit.
Yeah, and I did want to mention, I mentioned that podcast, and the name of the podcast itself is Overcoming Those Skilled Nursing and Rehab Stigmas. So just to kind of reiterate the name of that if you do search for it. So it's helpful for seniors and caregivers to really kind of understand what's going on in the area.
Absolutely. And honestly, it was such a blast doing it with you, hun. So it was super fun. I always low key, had a girl crush on radio DJs, and that's what I felt like. It was super fun.
Yeah. It was a great podcast to do.
It was wonderful. Well, awesome. So I'm going to go ahead and get started. Again, this is just the COVID effects on rehab. And again, like Darlene said, if you have any questions, put it in the chat box and we'll go through them at the end. So first off, obviously, there's been a significant impact on all skilled nursing facilities. And yes, that's what SNF means right there. We love our acronyms in healthcare. You know, the biggest thing that I think we've seen is a lot more respiratory type diagnoses. So of course, pneumonia, respiratory distress, but obviously patients, if they're leaving a hospital and coming to a rehab center, you know, for us anyway, 90% of the time, it's going to be for short-term rehab. So that means they are improving and they just need that next step down unit. So yes, they may be improved with respiratory distress or things of that nature, but they still have those things like a BiPAP or a Trilogy or just higher, you know, oxygen levels and things like that. So we've definitely seen an increase in that a lot. And then also kind of like a roller coaster of patients in the hospital. I know that we used to have a significant time of year when we knew, at least for here in Florida, where, you know, the snowbirds would come down beginning of the year after the holidays, and then it'd be crazy. And then during the summertime, it'd be a little bit, you know, more kind of scaled back patient-wise in the hospital. Now the hospitals seem to just be progressively, you know, very full all the time because of all these other respiratory type ailments and things going on. So that's the number one change, I think, in patient dynamics. But then the next scope that people don't even really think about is the Medicare and the insurance waivers and the way that we're paid. Obviously, on other realms, you know, ACOs and all that kind of bundle payments is a whole nother way that we're paid. But kind of the new way is with Medicare and insurance waivers, we've been able to utilize. So I'm going to skip over to the next one, and this actually lists, and I'm sorry, my computer is super slow today. There we go. This is kind of a list of what both of our centers take. The left side would be our Viera, and the right side would be Rockledge. So, you know, to expand into that a little bit more, you know, each facility has their own contracts with insurances. So during COVID, the waivers were set in place not only for, you know, maybe it's United Healthcare or Staywell or what have you, meaning that it waives the 3-day inpatient stay, or rather for the insurances, you don't have to wait for an authorization number, you just have to submit it. So it made it a lot easier for us to get a patient out of the hospital as quickly as possible to try to save those beds for any COVID positive patients, because obviously that's something that they were inundated with at the hospital.
This is
the one that's really...
Oh, I'm sorry, I didn't mean to interrupt you. I said everyone has these options. All skilled nursing and rehab have these same waiver options. I just want to kind of...
So it is deterrent on the insurance. So most of these insurances, they decided whether or not to participate in the waiver. Okay. Health First literally just ended like a day or two ago. So it just depends. You have to really keep up with it. And of course, we're the ones who are informed by it, but it does make it a tiny bit easier. The one that's been holding strong since the beginning of, you know, 2020 has been Medicare. And I'm going to go through that a little bit more in detail here in a moment. But, you know, ask if you are needing it or trying to place a patient to a skilled nursing facility if their insurance has one of those waivers, because then it could maybe help them transition to the next level of care in an easier, quicker manner. Okay. Does that answer it a little bit better?
I think so. We'll let some of the, you know, I work on the marketing side, so some of these folks are in the industry. They will probably may have more questions to play off of that.
Absolutely, and I'm going slowly more into detail.
No, you're good. You're good.
Thanks, darling.
So some of this is a little above my pay grade. So.
Oh, please, you're fine, girl. You're fine. So just so you know, for the Medicare one that I'm really touching today, the waiver is called 1135 Medicare Waiver.
Okay.
So per CMS, again, another acronym, that's just the acronym for Centers for Medicare and Medicaid Services. The 1135 waiver basically, again, waives that 3-day inpatient hospital stay rule. With anyone in skilled nursing or, in the hospital realm knows that that patient, prior to any of this, if they had Medicare or even certain insurances, it was required for them to have that 3-day inpatient hospital stay, meaning it can't be an outpatient OBS or WU, which is, a patient just got out of surgery and they're not even under OBS. So that means they don't need that 3-day inpatient rule. They can even come from a different setting, such as an assisted living facility, not even step foot in a hospital. We can still utilize that 1135 waiver. Again, this really just helps it in the sense of getting a patient to the next level of care without all the hoopla. And please pardon me, I could not get this into the program, but this is just an example of the 1135 waiver. So this tells you reasons why you would need it. Maybe they've just been exposed to COVID-19, or they use all their Medicare days, or again, they're trying to make sure that the hospital has beds open because they're being inundated with COVID patients. So it just has the regular information, where they're going to be transferred from and then to, and then you just have to ensure that you check the right box that's, has to do with the patient, and make sure that it's signed by a physician there on that bottom line. So I just wanted to give you an example. Any skilled nursing center would need that prior to bringing a patient in under that Medicare waiver. Again, this has nothing to do with the insurances. This just has to do with the Medicare waiver. The insurances, they tell us if they want to utilize the waiver or not, and when that ends. Therefore, then we go back to the regular, scheduled programming, and just ensure that we try to seek the authorization for that patient. So with that said, us at our facility, we have been kind of doing this for a really long time. I'm sorry. So with or without the waiver, we can try to bring a patient from an ALF or home or so on and so forth. Previously, before the waiver, what we would do is obviously try to just become investigators and make sure that they've had a previous 3-day stay that's within the last 30 days. Now, without this, it really helps to where we don't need to even do that anymore. We just get that waiver signed. But some of the things that, if you're trying to get a patient into a skilled nursing facility, whether it's from home or an ALF or a doctor's office, are just simple things like the face sheet, the history and physical, the most recent med rec, and a PT note. If, of course, we'd need that more so if it's an HMO type payer, but a PT note always helps, because naturally they're going to come to us for physical therapy or continued more individualized physical therapy. So that'll help a little bit. So just to kind of go over the new normal as to what we need, not only for ourselves as healthcare skilled nursing staff, but also for the patients. So prior to any patient admitting to us, to a SNF, skilled nursing facility, it is the CDC guidelines for us to ensure that we have a recent COVID test result within the last 42 to 78 hours, or I'm sorry, 48 to 72 hours. So what really helps us, honestly, is that if that patient winds up positive, then obviously we're not going to bring them to our facility. However, we can accept a patient that has been 10 days COVID recovered, meaning they've had improved symptoms over 10 days since their initial positive testing. In this case, most of the time, the hospital is pretty good about getting us a negative test. If the patient is coming from home or assisted living facility that can't really get their hands on a COVID test, they can come to us. Well, again, we have them on hand all the time. And what we'll do is just swab them and do a rapid before they even enter the building, just to be safe for our staff and our other patients. And for us, the staff, we get tested usually twice a week, sometimes just once a week. It depends on the COVID numbers in the area. But that just is something that has definitely become that new norm for sure, because people ask us all the time, families get kind of scared, like, oh, well, or how would you know if somebody has it or not? That's the great thing, is everybody has to get tested before they really even come in the building. So just being safe.
Yeah, I just, the new normal, it's just something the term has just become such an acceptable, I guess it is like the new normal. Is it the new from now normal, or is it the new normal,
It's funny. At first, I used to ask that question, and I feel like I've been in it so long now with, partnering with the hospitals and with rehab. I personally think that it's going to just become that. It's just going to be a part of the process from now on. Maybe the difference is, maybe not wearing masks as much, because obviously we're wearing masks no matter where we are at in our facilities, or even in the hospitals, of course. But yeah, I think that, getting those COVID tests and so on and so forth are really and truly kind of the way that they're steering towards, because it hasn't budged so far.
Right.
So, yeah, right. So the effects on services, this literally just lists services that we provide, dialysis, if we do provide transportation, at least at our facilities. So if they do have outpatient hemodialysis and they need to go to and from, we actually, because they're going in and out of our building, we put them in a private room. So that's a big change. So of course it affects our, bed availability and so on and so forth. For a while there too, some docs were only doing Zoom calls and seeing them virtually. And that's something that some of our docs were doing too. So our nursing would have to figure out, share the iPad or laptops and make sure that they're helping the patients get on those calls. Now it's a little bit easier, obviously, with testing and so on and so forth. But yeah, that's definitely stuff that we just had to venture through and be careful with. But other than that, this is just a lot of those other things that we can do at both of our facilities, Viera and Rockledge, pain management, social services, our dietitian, and the effects of that has wavered over the last 2 years. But I'm very happy to say that most of that has really become quite better. In fact, even when it first started in 2020, everyone had to isolate in their rooms. So sometimes patients who may have had mild dementia and say they got physical or occupational therapy in their room, they thought they didn't get their therapy. So then they'd call their son or daughter, and then their loved ones would call me, and then they'd be complaining. I'm like, oh, and then you check into it, but really they were just doing the therapy in their room and they forgot. So when they don't see that gym and they aren't physically going down to the gym, or if they feel confined to their room, that affected so many people, whether it's customer service for skilled nursing facilities or just, the overall well-being of the patient. They felt stuck there, and it was very sad to see it like that.
Yeah.
Consulting physicians, obviously, even through this, we've figured out how to do respite care, hospice or palliative care in our facilities. Same thing, if it's a respite just means, say you are your caregiver for your loved one and you're going to go out for a vacation for a week or two, then, you contact us and we'll see what we could do for the respite care. And obviously that's another situation where you don't necessarily have a COVID test. So we would do it upon admission to the facility. So we always try to do that. This again just goes through all of the types of physicians that come to our facility. So every patient is paired with an internist, and then we have consulting docs like infectious disease, physiatrists, wound care, pulmonology, audiology, podiatry, as well as psych. And again, when almost all of these docs wanted to do virtual visits, it just became too much on on the staff. It was very taxing, but thank God we're on the better side of it. I will say too that, every single realm, not just healthcare, has obviously been dealing with a lot. Since COVID, I know that a lot of places have staffing issues, and that's something that really, took a toll on healthcare in general too. So just remember, be patient with skilled nursing facilities. Sometimes, they've had people that are just like, forget it, I'm done with healthcare in general. They got scared, or they're just done with that burnt out feeling since COVID. So a little bit of patience and understanding, and knowing that, these are some of the hoops we have to jump through on top of the other regular processes that we already have to do, goes a long way for all of us, and just trying to adapt and have patience during this new normal.
Right. So do you think, we talked a little bit about the effects of COVID on long-term care and skilled. Do you think that these effects, we talked a little bit about that, are going to be more of a permanent, or do you think that are there rules that have been put in place to keep residents and staff alike safe? Are they long-term decisions, or do you think that some of those will be changed?
Well, obviously the testing from the hospital and for the staff, I do feel like that is a wise decision to keep folks safe, but ultimately, yes, for a while there, it was kind of touch and go. You didn't know, because it felt like all the rules were changing while they were trying to figure out COVID and how to deal with it, and so on and so forth. But I think the way it is now, currently, I think it's kind of going to be stuck there for the long haul. Yeah, I do.
Yeah. Do you think some of these changes they put in place are like a safety net in case another pandemic or any kind of, it was kind of a lesson learned, in order so that you don't have that bumpy road like we did at the beginning, where you've learned a lesson from that, so that it's not as bumpy the next time we have a pandemic or a really bad flu outbreak or something of that nature? Do you see what I'm saying?
Yeah, no, I understand. Actually,
Okay.
yeah, it is kind of a lesson learned. Like, there's some, like, for instance, shutting everything down. I was kind of stuck in my facility, not even able to go physically see the patient in the hospital to try to, round out my clinical evaluation on the patient. So that was kind of rough. You kind of try to become more of an investigator. But I think that, that's kind of the lesson learned. The truth is, some of it's good. It is positive lesson learned, meaning they should continue to do it. But other things, maybe not. Maybe this way they have a little bit more guidance in case there is another variant, because God knows there's variants all the time, right?
Yeah. I think that's going to be life. I mean, I could clearly be wrong. I'm not a scientist, or don't pretend to be one on TV, but I do think, I think COVID is here to stay. I think it's just trying to manage and live your life with it. I think it's going to be the deal with it. So I think it's, learning how to work within the realms of it. So
true. Very, very true. Absolutely.
Yeah. So I have some questions here. So I have a couple in the Q&A, but I also have a couple here. So I'll kind of get back to some of these. And I did want to let everyone know we are recording this, so I will shoot it over in a video, YouTube link. So do you think the stress, Evelyn asked, do you think the stress caused by all the fears has impacted immune system, leading to uptick in illness?
I absolutely do think that. I mean, especially, again, I'm more so seeing the senior citizen realm, and just a small percentage of them, but within 2 centers, I mean, of course. And not only that, but the fear of seeing, your friend, your staff member that you've become really close with, maybe they got COVID, or maybe they know someone who knows someone that had it, and it really affected them to the point to where they're on a ventilator. And then what does that do? It just adds stress. I mean, you know what they say, you can even pass away from a broken heart. Of course, you can just, stress yourself to where you become very sickly and therefore bringing down your immune system. I mean, the best way for us, I feel, the way that we've been able to get through it is having dietitians on staff, as well as psychologists and mental health counselors to talk to not only the patients, but sometimes us as staff members needing to get through it. But leaning on each other really did help. And again, like I said, trying to help the nutritionists give out food that's nutritional enough to help build up their immune system and also give them the mental health type well-being as well. I mean, I feel like we really did the best we could with what was given to us.
I feel like we're at a point, and we have been for a long time, so this is not new, that the joy in senior living and senior housing, all of that, we need to bring back that you still have to have joy. You can't just
absolutely.
Yeah, to me, it just breaks my heart.
It's getting back there. Actually, yesterday it so is getting back there. Yesterday, I went to the building to do some, computer work or whatnot, and I went into our activities room, and all of them were painting hearts. And of course, they had the choice if they wanted to have a very, very small amount of like champagne. And then a few days before, I had admitted a husband and wife duo, and I set up a little cute date for them because I saw they had champagne. So I got them a little cake and champagne, and seeing things like that kind of did stop a little bit. I mean, obviously activities at all skilled nursing facilities did what they could, but it was so hard, to deal with all these different restrictions. And mind you, of course, they were painting their little hearts, and they were still, spread out throughout the room and, had a safe distance. But at the same time, they were at least in the same room, because for a while there, you felt like you couldn't even do that. So
people need people. I mean, people need interaction with people. I mean, it's part of what gives you life, so. And then I have the other question from Paula. Has anyone seen since COVID the changes in resident behaviors, more aggressive anxieties, stresses, not being able to cope with COVID protocols?
Not so much anymore, again, because that's how it really felt and looked like in the beginning for us, in the beginning of 2020, when it felt like everything shut down. I saw the stress firsthand, very much so, of patients who would, their son or daughter used to come and visit them every single day. And then from it to turn into them going into our courtyard and having lunch together, to either not being able to visit at all or having to see each other through a window. That definitely hurt. I hate to say this, but I mean, I brought candy a lot to try to cheer them up, and sometimes it helped, and sometimes, you're like, okay, we got to slow it down and not give them too much candy. But sometimes even just sitting and talking with them went a long way as well. I don't know that I would say aggressive or intense behavior, so to speak, but it was definitely a lot more anxiety. Yeah, I saw a lot of folks with a lot of it.
I think the whole world suffered anxiety, but seniors had to have it at a much more elevated level.
Yeah.
So I have an anonymous attendee that asked the question, are you saying that the Medicare Advantage plans are following different rules regarding the waiver than original Medicare?
Say that one more time. Sorry, I was reading it while you were.
No worries. Are you saying that the Medicare Advantage plans are following different rules regarding the waiver than original Medicare?
Absolutely. And that's what I was kind of, touching on a little bit earlier. What I showed you was the Medicare waiver. It's no way, shape, or form has anything to do with those HMOs. Because they make up their own rules. Let's be real. They just do what they want. For a while there, yes, at the beginning of 2020, it seemed like almost all of them were, United Healthcare, Aetna. So all we had to do was submit the patient's paperwork. We didn't have to wait for that authorization. It was just wonderful. So now, yeah, it's already gone back. I'd say since 2021, if I'm totally honest. A few have still continued, but it's only like 2 or 3 compared to, there's just lists and lists of those Medicare HMOs, those managed plans that are out there. So everything from Care Plus, United Healthcare, Aetna, TRICARE, Blue Cross, like all of those, none of those have the waiver right now. So it's a lot of, that part ended. It was blissfully beautiful and then it ended. But we're very grateful that the Medicare, the traditional Medicare, still holds up. It helps a lot.
Yeah, yeah. And we did have a comment from Angela that is a heartbreaking comment, that she has a home care client that has PTSD from the lockdown.
Yeah, that's what I was reading. That's,
Mhm.
I'm not gonna lie. And you know how everyone says they drank more and they gained more weight. I felt like I saw a lot of that too. Like I said, the anxiety and yeah, like them just being alone and not getting as much interaction as usual. It just would hit me some days, it kind of, if you're in healthcare, you care, and to see these seniors just looking depressed, it's not okay. And there's certain times you can do something, but what else can you do in this situation?
And a lot of it's going to depend on their cognitive issues that they may already have, their life experiences that they've been through. I mean, if they've had a rough life experience, it may just be something that you've just compiled onto with COVID. And I was even talking to some folks on the assisted side that were telling me that some of their, dementia patients were struggling with them coming in with the masks because they didn't recognize them. They were struggling to see past, having the masks on when they were coming into the rooms and stuff. So that was causing their patients anxiety not to be able to recognize them with masks on. So all of those things combined clearly. And I know, Adrianne, you and I talked when we did our podcast. I think it was like after the podcast. I don't think it was on, but it may have been, that I don't think that people outside of the senior housing community, or if maybe you did have a senior that was going through it, you truly can appreciate what seniors and senior communities went through during COVID. I don't think they don't get it, because it's not something that's been on 2020. It's not something that's been shared as far as any kind of real life story or really understanding. And I think one day it might be, but I don't think that there's really a true understanding in general.
No, absolutely. I don't think so either, because yes, hospitals went through the ringer too. But because we're that next step of care, we're not that emergent care, unfortunately, in some ways we were kind of forgotten about, and the fact that, we were legit on lockdown, but also assisted livings too, it just became a very scary and anxiety ridden time for staff and patients alike, for sure.
And clearly different states varied as well. I think that can make a difference as well, as far as the rules and regulations in each of those states as well. And then there was another comment, and I'm not sure what this means because it is an acronym. MAs are bound by the same rules as traditional Medicare for the 3-day rule, which is not changing. I heard this in another event yesterday. So this piqued my interest. It has not officially ended as a waiver. Will go through April 16, 2022.
The MA what?
It's the MAs. It's an acronym.
Is it the Medicare waiver? I can't see that on here.
Oh, you can't see that screen? Medicare Advantage plans. Sorry, it was, yeah.
Oh, so when I say an HMO or a managed Medicare, that's the same thing as the Medicare Advantage plan. I don't know why they have so many names for it, but they do. So anything other than Medicare, other than traditional Medicare, like I said earlier, yeah, they just stopped all those waivers. They did them throughout 2020, but they really kind of stopped throughout towards the end of 2021 and up until now. So unfortunately, that's the case. But the good news is I heard, please do not quote me on this because this is just what I heard, is that they are possibly considering the traditional Medicare waiver to be all the time, meaning it will always be the new norm, so to speak, that Medicare will never require the 3-day stay. I pray that this is true, so that way we don't have to, worry about it ever, ending, but you never know. So who knows what they're going to do, but that is just something that I heard about Medicare. I know, right? You read my mind, girl. I hope that is true.
I hope that is
We
true.
all do.
Yeah. Yeah. All right. Does anybody else have any more questions, comments before Adrianne signs off with us today?
And real quick, Paula, that's awesome. Switching with the nurses and the CNAs and the activities and housekeeping, taking turns visiting with the patients. That's phenomenal. I'm glad you did that. I bet it made a world of difference for your patients.
Yeah. I'm glad you caught that comment because I missed it.
Yes, that was absolutely. Teamwork makes the dream work, baby.
It does. It does. Yeah, absolutely. Everywhere. And I just wanted to also comment that we are going to be sharing, and I put this note in there, I'm going to email the link in a YouTube form so you can share this with colleagues or friends or whoever you think might enjoy this webinar as well. And then also if you want to go back and look at it, and I'll also share Adrianne's contact information. So if you have any questions or you would like to connect with her, you'll be able to do that. So that email will be coming in the next day or so. So keep a
awesome.
eye out for
Thank
it.
you.
So, all right. And don't forget, check out her podcast. It's a great podcast. And follow SeniorLivingGuide.com podcast as well. So lots going on here over at SeniorLivingGuide.com. So, all right. I think that's it. Please feel free to reach out if you have any more questions after the webinar as well.
Thank you, Darlene.
Thank you.
Rock,
Everybody
girl.
have a great day.
Bye, toodles.